Hello, and welcome to Mentoring the Mentors, an institute that accelerates your learning curve. My dear educator, let's talk about how we can promote mental health and well-being among our students. You know pretty well, board exams, they are approaching near, they are around the corner. So all the students, they are busy preparing for their exams. And even many of them, they are appearing for the entrance exams, right? For law aspirants, medical, or maybe IIT. I mean, they're appearing for so many different examinations, so it causes a lot of stress among the students. So, being a teacher, it is our responsibility to talk to our students, to look after them, and to provide them with some kind of suitable solutions, a way forward where they can go ahead and vent out their energy and they can share their problems with someone. So, you see, if we look at our classrooms, we have got students coming from different backgrounds, different cultural backgrounds, different languages they are speaking. They have got different learning styles, different ambitions, different targets, different way of handling the things. So, despite having same kind of teaching learning materials, similar kind of instructions, whatever we are giving to them, same learning objectives we are defining for them, still our students, they are not able to achieve those learning objectives. They are not able to reflect those learning outcomes. So what we can do, apart from the various changes that are there as per the learning styles, obviously everybody is different. They will be performing in a different way to different extents. This is what we call self-paced learning. But my dear educators, there can be a number of reasons like students, they are not performing well. These reasons can be the result of the mental stress that they are going through, right? You know pretty well, it is very difficult for the children to cope up with different kinds of stress that they are getting from the school, from like because of their own ambitions, from the home, from the parents, right, from the friends as well. So they are facing different kinds of problems, so that leads to a lot of mental stress. And they can also have some subject specific problems, right? They can be bullied also. I mean, they ऐसा भी हो सकता है कि some students maybe they're getting bullied by some other children, their peer group, that they must be maybe suffering from some kinds of diseases. There can be some family issues as well, and there can be some interpersonal issues as well, and this may lead them to go ahead and I mean, be addicted to substance abuse, etc. So being a teacher, what is our responsibility, what is expected from us? So my dear educators, to address such kinds of issues, all of us must act as wellness ambassadors of the school. Awareness about mental health and well-being of the students is essential to reap the benefits of pedagogical improvements aimed by the competency based, or maybe when we talk about continuous professional development programs. So these are being held for all of us. We should also focusing on this mental health of our students. So my dear educators, the teachers, when we feel like I am a science teacher and the particular person is a social science teacher, she is teaching English or maybe Hindi, we are teaching different languages, maths, or maybe other subjects, right? So we think like we are not professional counselors. So how we can look after the problems of our students? What we have to do, we don't have to be the professional counselors. We have to listen to the problems of our students, and we need to analyze and categorize into different subcategories. Like there can be different types of problems. We need to identify the problems that we can deal as teachers. For example, there can be some problems related to subject specific difficulties. Maybe there are some cases of bullying that we can easily handle. We can talk to the students and we can help them to come out from those kinds of problems. There can be some problems like related to the home environment, related to the physical symptoms that we observe in the child. For that, what is required is we should talk to the family during PTMs, or maybe otherwise also we can talk to the parents, we can invite them, or if it's really very important or crucial, we can also visit their homes and accordingly we can talk to them. And apart from it, if we find such kinds of problem like the child is undergoing some kind of stress or is having any kind of disability, as it is mentioned, like 21 kinds of disabilities are there as mentioned in the Prashast guidelines as well. So we can refer to a counselor as well after talking to the parents, right? So this is what we can do as teachers. So for all this, we need not to be the professional counselors, but at least we can listen to the problems of our students and we can guide them accordingly. we have to be very, very observant, and we need to see, like, if there are any kind of significant changes in the interest and the hobbies of the students. Maybe there is change in the social relationship, they are changing their friend circle frequently, there is drastic change over there. And if we notice significant decline in the academic performance of the students, and maybe we notice some kind of physical symptoms, physical changes they are there, and maybe we also get to know, like, the child is using any kind of substance abuse is there, and maybe the child is trying to harm himself or herself. If such kinds of emotional or behavioral problem we notice in the children, then we should obviously take some action, talk to the child, talk to the parent as per the problem or the symptoms that we observe. There are a few kinds of strategies in the support system that is there in the health and well-being curriculum that is also defined by CBSE, and we all are following it. And you can also check a complete playlist on health and wellness. 11 modules are there that is available on my channel as well. You can watch those videos, and even I can put a link in the description box. Also, you will be able to find a thumbnail at the end of this video. Make sure you click and watch all those videos, that will give you some ideas how we can conduct various kinds of activities with our students, right? That is a comprehensive, right? 11 modules, they are there about the health and wellness of our students. So let's understand, teachers, what we have to do is we don't have to label the students. Ki, this child is having that problem, right? This child is having this very difficulty. No, not at all. What we need to do is we need to screen our students, right? We need to check what kind of problems they are facing. For that, I've already shared, there is a Prashast guidelines, they are there. Prashast app is also available, you can check it out. You can even enter the different kinds of, like, changes that you are observing in the students, and accordingly you will be able to identify if the child is suffering from any kind of disability. 21 kinds of disabilities they are there as per the Right of Persons with Disabilities Act 2016, right? But make sure you are not labeling the child. Screening is done in order to provide the students with some kind of help, scaffolding we can provide, and we'll be able to help them out to come out of that kind of problem, right? So that's why we need to go ahead with the screening. So teachers, make sure you continuously monitor the changes that you see in your students. Maybe it's related to behavior, or maybe any kind of academic performance related changes there. You have to be very, very observant, right? Make sure you make a note of it. You can keep your anecdotal records so that you can refer to how the child was behaving earlier, what was the child's academic performance earlier, and now there is a significant change over there. So accordingly, you can help the child. Make sure, for one more very important thing, as you can see here on the screen, like, you should ask your students, it's okay to ask for help if they are suffering from any kind of mental stress, like they are feeling, they are under depression, there is any kind of anxiety, right? They should say, I will ask for help before my problem get out of control. It's as simple as, like that, if I am feeling thirsty and I'm asking for a glass of water, I'm hungry and I'm asking for meal to be served to me, so it's perfectly okay. Like, if we get hurt, obviously we visit the doctor, we get any kind of problem over there, right? Likewise, if I am having some problem, so accordingly it is perfectly okay to ask for any kind of help from a counselor or the teacher, they can help us accordingly. And make sure, teachers, you have to be the active listeners. Active listening is really very, very important. Sometimes the students, they come to us with their problems, and what do? We, maybe we are busy with our own work, correction work, our lot of documentation is there. I do understand you have to do a lot of academic and admin related work, but make sure when you are listening to your children, that time you should not be busy with some another work, just full concentration to be paid towards your children. As there is one strategy also which is called slant, active listening strategy. I'm just sharing it with you. I have already shared in any kind of videos earlier with you. Slant, SLANT. Slant technique means Like S stands for sit. When you are sitting with your students, that time you should, I mean, when the child is sharing a problem, you should sit and you should listen to your child. L is lean forward and listen to the child. Whatever the problem the child is explaining, just leave all other work, just listen to your child, focus on the problem, listen to the words properly. And A for you have to be very attentive, and even you can ask some questions, right? You can say yes, agree, or yes, another thing if you want to inquire more. And N is nod your head. Yes, yes, you're listening, right? You are listening whatever the child is conveying to you. And the T for track the speaker. You should be on whatever the lines, like you should be on the same lines wherever the child is speaking. I mean, as an aki, you are just thinking about a line that the child has already spoken or shared, and then other statement the child is giving right now, you are not bothered about that. No, that is a technique. SLANT, I'm repeating again. S for sit up, L for lean and listen, A for be attentive and ask questions, N nod your head, and T track the speaker, right? And timely provide the solution to the child. Got it? So active, we all have to be active listeners, my dear teachers. And teachers, we can also include some kind of activities for our students. Sometimes we are busy with some work, and I do understand we are not able to devote proper time to our students when they are sharing some problem with us. The child is feeling stressed, the child is feeling depressed, child is anxious. You can ask the child, if I'm not available that time, make sure you jot your points down. You journal writing can be done. Do provide some creative writing exercises, activities for your students. Some art projects can be there. You can involve your students in group discussions also, so that they can come forward and they can share the problems that they are going through. Any kind of problem they should share confidently with you. So my dear teachers, such kinds of group activities can be organized for the students. Collaborative learning, cooperative learning has very important place for relieving the mental stress of the students, right? Like there are a number of collaborative and cooperative learning strategies that have been shared on my channel. You can check it out under the playlist visible thinking routines, right? I'm repeating again, it's visible thinking routines, and check it out, the number of strategies that are available there. So my dear teachers, sometimes it happens like we feel maybe the emotions, they are being happy or sad or angry, that's it. But like there are number of emotions. We are using WhatsApp, there are number of emoticons. Talk to your students why there are number of emojis, right? Sometimes we are undergoing a kind of situation where we are having mixed emotions, right? We are not able to identify our emotions, what we are going through. So we need to share the emotional vocabulary with our students also. By helping our students identifying and articulating their emotions, we as teachers can empower them, express themselves more effectively, and seek help when needed. They should also know what kind of problem they are going through. They should not feel like it's shameful to ask for any kind of help when they are under stress. No, it's perfectly okay for everyone. And we also need to promote the idea of peer support. They should have their networkings in the classroom. They should share the problem with each other. Let me tell you, my dear teachers, the students, they are very comfortable sharing their problems with their peer group also many a times, because they feel very confident. They are of the same age group. They're coming from similar kinds of backgrounds. They know each other. So what we should do is we need to facilitate group activities, as I've already shared with you. Cooperative learning, collaborative learning, various visible thinking routines, they are there. We need to include such kinds of activities to make peer connections better, right? So these activities can help reduce feelings of isolation, loneliness. Most of the time, why the children they feel anxious? Because they feel lonely. They think they don't have any friends to talk to, right? They feel they are alone, and the problems, they are there for them only. Let them talk to their friends, let them spend time with their friends, like while studying also, during the play as well, during discussions and various activities too. So my dear educators, we need to discuss the stress management techniques with the students, including, first of all, is a time management skill. Why do we have stress? Most of the time, if you just think, most of the time we have got stress because we have got shortage of time. We plan so much and we have got very less time, and we're not able to cover that much work in that limited time. That's what leads to a lot of stress. This is what happens with our students too. They plan a lot. I want to do this, I want to do that, so they don't have the realistic goals. They have got, like, suppose now exams, they are approaching near. This is the now December, we have entered, stepped into December, and January they'll be having their practicals and their board exam. The entrance is already going on, and maybe if they have not studied earlier, right from the very beginning, it will be very difficult for them. They'll be undergoing a lot of stress. If they have studied, obviously, then at this time they should not panic. They should go ahead with various kinds of teaching learning strategies, revision strategies, that I'll be sharing in my next video, right? A few tips I'll be sharing with you where the students, they can revise whatever they have done earlier very easily, right? I will be sharing with you various revision strategies. So we need to develop coping strategies for handling academic and personal challenges. Coping strategies like coping with emotions, coping with stress, that I have already discussed in life skills video, life skills by WHO, that is World Health Organization. Make sure you watch that video as well, right? So my dear educators, as teachers, we need to be aware of mental health resources that are available with us in the school, in our community. Like if any counselor is available, any other help is available, we need to talk to our students and we need to refer to the children for that particular helpline or assess accordingly, because teachers, they should know how to connect the student with the counselors, school psychologists, or maybe external mental health professionals as and when required. Obviously, when you are connecting with some an external person or any case like counseling etc is required, make sure you involve the parents as well. Don't handle it alone, right? You have to involve the parents, you have to involve the management, the principal of the school, right? Make sure accordingly you should take any kinds of steps, right, further. So my dear educators, we should maintain open communication with the parents. Do not hide anything, and also ask them to share the problems openly. They should also not hide anything. As we visit the doctor, if we share the problem properly, right? If I say I'm suffering from fever, I have pain in my throat, I have cough and cold, or maybe I feel shivering as well, I have to share the proper symptoms. Then only I will be able to get the solution of my problem. Otherwise, if I hide a few things, like what I have eaten, what I have had during my lunch or breakfast, right? Maybe I have had some outside food or not. If I don't share, obviously the doctor will not be able to cure me properly. So we need to ask the parents to share their problems, the child that they are going through, they have to share openly. So sharing information about students' mental health and well-being can facilitate collaboration between home and school, right, in providing necessary support. That we should understand. And collaboration is the key. Let's all join our hands. All means teachers, management, school counselors, school staff, the parents, everybody, the mental health professionals, so that we can like address the needs of the students comprehensively. Let's join our hands, make a bridge for our students to easily walk on. For that, make sure teachers, what else you have to do is, there is a number, helpline number given to us by CBSE, 1800 118 0004. We need to share the same with our students. That's the helpline number in case a child is going through exam stress, anxiety, or maybe other issue. The children, they can ring up at this number, talk to the professionals that have been appointed by CBSE. They'll be listening to the problems of the child and would be guiding them for proper solutions, right? They'll be sharing a way forward. So, my dear educators, if you want to know more about mental health and wellness, as I've already shared, go and watch the videos that are there on my channel under the playlist health and wellness. Also, like CBSE has or arranged for the school health and wellness, CBP, competency like capacity building program on school health and wellness for 2 days, and another is on promoting mental health and wellness among students for 1 day. So these capacity building programs you can attend by enrolling yourself And by going to CBSE training portal, enroll yourself and grab a certificate, right? Get to know about number of activities or strategies that you can go ahead with that. So my dear educators, stay tuned to Mentoring the Mentors to know more about such important things related to teaching, education, handling students, classroom management, and many more. Do support us by liking, subscribing, and sharing our videos. Thank you, all of you. Have a nice day.